a possible change in the COVID isolation guidelines. First of all, good morning, sir.
Good morning, Tim.
Good to see you again.
Likewise.
What could this change be? And I guess it's not a done deal yet?
It isn't, no. So CDC, it's possibly spring when they're going to announce new revised guidelines around isolation, Tim.
Okay.
So if you do get COVID-19, if you're fever-free without the help of a medication for 24 hours at least, then you don't need to isolate. That aligns with what we currently recommend for influenza or RSV,
Okay.
and actually will align CDC guidance to what some states are already doing, such as Oregon and California. Right. However, it is controversial because, remember, this is still a deadly disease. So don't want folks to start thinking, okay, COVID-19 is just any other respiratory virus. It's not. If you look at the data from this most recent winter peak, we had 1,500 deaths a week in the U.S. alone. And remember, we don't have any kind of treatment for long COVID. Right. So, keeping those things in mind, there's suggestions from the CDC that this guidance will be revised.
And I'm also just curious because COVID's been getting, it seems like more and more contagious as it's getting less and less severe. So how do you reconcile that if it's getting more contagious with shortening down the isolation guidelines? Is it just not able to stay robust in people's system?
Well, the premise here, the CDC officially wouldn't comment on this. So, but the premise here is there's been, immunity either through vaccination or through people getting infected, which has led to this, and the virus has evolved to an extent where you may come down with milder symptoms. However, again, the caveat here is if you are someone with underlying medical problems or at higher risk for developing severe symptoms from COVID-19, then it's always good to take those same precautions we've talked about so many times before.
And now you had mentioned long COVID. I think there's a new study that came out that said pregnant women seem to be getting long COVID. About 1 in 10, if you're infected with COVID, while pregnant, you go on to develop long COVID symptoms. Is that more or less than what we're seeing? I imagine it's more than what we're seeing in the general population.
Yeah, so this is something that women need to keep in mind. And, the take-home message here, Tim, is that if you do have obesity or anxiety, depression, financial stress, these are some of the risk factors that the study looked at in women developing long COVID, more propensity to develop long COVID. And symptoms include fatigue, malaise, dizziness, a little bit of work that can lead to feeling tired, things to look out for. So clinicians need to be aware as well as mothers. Now, more research is needed what happens in terms of outcomes to babies born of mothers who do develop long COVID. So more to come on that.
Yeah, and those are kind of a constellation of symptoms. People wouldn't necessarily think of COVID right off the top of their head. So that's why clinicians need to be more careful here. All right, lastly, it's Valentine's Day.
Yes.
What are some good heart health tips for people?
So going back to the basics again, get that annual wellness visit with your doctor. Make sure you know your history, medical history, as well as your family history. Take your medications. If you have high blood pressure, diabetes, high cholesterol, take those medications on a regular basis. It will change how your disease management, disease progresses long term. Quit smoking. I can tell you, it hits home for me that my cousin's husband actually quit smoking. It requires, some level of willpower, but also, there's aids that can help, such as nicotine gum, for instance. So quit drinking. It's the basics, Tim, that folks need to start doing. Healthy diet, more active lifestyle.
And as always, it's doing these things before you have problems. It's a lot easier to sort of prevent them than it is to management, right? Like
that's right, absolutely.
Ounce of prevention's worth it.
But if you do develop something, then it's important you get those regular checkups done and take your medications and keep that disease in check.
So keep that ticker healthy on Valentine's Day.
That's right.
Doctor, good to see you again.
Thank you, Tim.
We'll be back.